ARFID, what it is, why it happens, and what actually helps. Let's talk about ARFID because it's one of the most misunderstood eating disorders, and honestly, it deserves better clarity. ARFID stands for Avoidant Restrictive Food Intake Disorder. And unlike other eating disorders, this is not about body image, weight, or wanting to be thin. People with ARFID aren't trying to diet, they're trying to cope. Sometimes, on rare occasion, it can be combined with other eating disorders that include weight and shape that, but those are separate diagnoses. ARFID shows up as very limited eating that can be driven by things like intense sensory sensitivity to texture, taste, smell, or appearance, fear of choking, vomiting, or getting sick, very few safe foods, anxiety around eating, especially in social or unfamiliar settings. Over time, this can impact nutrition, energy, growth, medical health, and quality of life. Now, a really important point. ARFID isn't entirely rare. Estimates vary because the research is still evolving, but community studies suggest that upwards of 15% of people in the general population, while other studies say it's a lot lower. But overall, many people may experience ARFID-like patterns at some point in their lives. So if this sounds familiar, you are not alone. Often it will present itself in the early childhood years, unless it's stemming from a food trauma, which can occur at any time. One area clinicians are paying much closer attention to is the overlap with neurodivergence, especially autism spectrum disorder. Research shows that about 1 in 6 to 1 in 7, roughly 16% of individuals diagnosed with ARFID also meet criteria for autism. However, that does not mean having ARFID equals having autism, as they do not always go together. That overlap makes sense when you consider that many individuals with autism have highly sensory sensitive nervous systems. Differences in texture, taste, smell, and even internal body signals like hunger can make eating feel genuinely overwhelming, not willful, not behavioral, and not something someone can just push through. We call the differences in experiencing one's internal world more powerfully than others an altered interoceptive awareness. Interoception is our ability to notice and interpret internal body signals. We all have it. Things like hunger, fullness, thirst, heart rate, breathing, temperature, and sensations from the gut. These signals are processed through networks involving the brain, nervous system, gut, heart, and lungs, and they play a major role in how safe and regulated we feel in our bodies, and how we interpret the signals our body is trying to communicate with us. When interoceptive awareness is altered, those signals can feel too big, too small, or distorted. Someone might feel overwhelmed by internal sensations, barely notice them, or think, I honestly can't tell if I'm starving or full, or I feel kind of sick but can't even tell how. This isn't a lack of effort or a person being manipulative. It's the nervous system misreading internal cues, and it's real. For some people, ARFID is primarily sensory-based. For others, it develops after a negative food-related experience, like choking, vomiting, reflux, or illness. And for many, ARFID overlaps with anxiety, trauma, ADHD, or other neurodevelopmental differences. In more severe cases, ARFID can require a higher level of care, especially when there's significant nutritional compromise, which can happen especially when the safe foods become fewer and fewer, even if overall caloric intake is still kind of okay. But often there is unfortunately a weight loss association, and in severe cases, failure to thrive concerns, medical risk, and interference with daily functioning. That's not a failure, it's about safety and support. Here's the hopeful part. ARFID is treatable, and treatment does not involve forcing, shaming, or pressuring people to eat, but it does require a lot of patience. Evidence-based approaches include CBT-AR, a specialized form of cognitive behavioral therapy for ARFID, gradual supportive exposure work done at a pace the nervous system can tolerate, sensory-informed and occupational therapy approaches, interventions that improve interoceptive awareness, helping people better recognize hunger, fullness, and other internal cues, higher level of care treatment, like residential or inpatient eating disorder programs when severe. At KML, we have specialists who focus specifically on ARFID using these approaches, including therapy, exposure work, and alternative evidence-based supports like listening-based therapies that can help improve interoceptive awareness. We also offer comprehensive psychological testing assessments, which can be really important for identifying overlapping neurodivergence, like autism or ADHD, that may be contributing to the eating patterns. Recovery from ARFID doesn't mean loving every food. It means more tolerance with food, flexibility, less fear, better nourishment, and more freedom around eating. If this resonates for you, your child, or someone you work with, there is help, and there is real reason for hope.